due to very large doses of vitamin B6 taken by people who had premenstrual syndrome, thinking that they could correct it by doing this. A second theory, again, where we reviewed the evidence, we reviewed all of the studies which we could find, and had to judge that the therapy was ineffective, was the subclinical hypoglycemia theory. The notion here is that there is a hypoglycemia that people get, and that these folks are the people who suffer from premenstrual syndrome. In fact, the remedy here, of course, is an anti-hypoglycemia diet, a diet where you eat frequently and eat fairly large amounts of carbohydrate. Here again, if one looks at all of the data that we could find and reviews that, looks at how well the studies were done, whether the clinical trials were well done, the answer here, too, was that we didn't feel the evidence warranted this type of theory being accepted either. A third theory is a theory that essential fatty acid metabolism somehow is disrupted, and that a prostaglandin deficiency, these very interesting substances, a deficiency exists here. The remedy that's suggested by the proponents of this particular theory is something that Mrs. Stevenson again mentioned this morning. They suggest evening primrose oil or certain other vegetable oils that are supposedly high or that have effects on prostaglandins may be the answer here. Again, the evidence from the studies that have been done is poor. A fourth theory is the relative magnesium deficiency theory. The answer here is magnesium supplements. Again, not much evidence. What about the fat-soluble vitamins? Well, vitamin E does come in here. There's a theory that suggests subclinical vitamin E deficiency is the answer, and that vitamin E supplements are the way to go. And again, not much evidence for this. Again, the lack of well-reproduced or reproducible clinical trials still is what plagues the support for this theory. And finally, the caffeine sensitivity. People thinking that if they just, if caffeine was just eliminated from the diet, that this would work. And again, no evidence that symptoms go away if that's done. So the basic point is, at least from our reviews of the evidence to date, not much is there that suggests that there are dietary remedies that are easily adaptable that will give those who suffer from this disorder much relief. Now, if we look at all the dietary remedies that are being propounded, there are some common elements here, and let me just mention a couple of them. One is the no or low salt hypothesis, that if you just eliminate salt in the latter half of the menstrual cycle, that'll do the trick, or no or low alcohol. Now, there's nothing wrong with doing these things for other reasons, but if one thinks that that's going to change symptomatology in this disorder, I'm not sure it will. The caffeine avoidance is another common element to many of the books that I'll mention in a minute, and the strategies that have been suggested. The vitamins, particularly B6 and E, are emphasized. And finally, this hypoglycemia. Most of the books that I'll show you combine several of these theories in the diets they recommend. And again, either individually or in combination, doesn't seem like there's much evidence on these. Certainly more studies are needed, but as of today, not much can be said. Let me just show you the kinds of ranges that are being suggested in some of these books and why I'm a little bit concerned. With magnesium, the RDA for magnesium is about recommended dietary allowance, the amount experts at the National Academy of Sciences from the Food and Nutrition Board suggest are probably the best guess for what we need, most healthy Americans need. Toxic effects are begin to be seen at about 1,000 milligrams, and one of the problems is on calcium absorption, and some of these books are recommending considerably higher levels than that. With vitamin B6, the recommended allowance is only about 2 milligrams, and toxic effects begin to be seen at about 500 milligrams. Some of the premenstrual syndrome treatments go as high as several thousand, and the kinds of things that are experienced include headache, dizziness, nausea, and peripheral neuropathy. So clearly there's some reasons not to do these things. With vitamin E, the recommended allowance is about 10 international units, and toxic effects, at least from the sources I've consulted, begin to start at about 400 to 1,600 international units. And the kinds of things that are experienced are fatigue, skin rash, and abdominal discomfort, the very things in part that we're trying to get rid of. So the basic point is that there are some possible harm that can result from this. It's not just that it doesn't do any good. Let me just mention a couple of books several books that I don't think are really the way to go. Once a Month, Self-Help for PMS, PMS and You. It's not that everything in these books is unhelpful. They do have some advice that's helpful. It's just that the diet section of them tends to be a little bit undemonstrated. The Underburner's Diet, Midlife Health, The Women Doctor's Diet for Teenagers, and my absolute unfavorite, How to Be Your Own Nutritionist. And I'll come back to that because this gentleman is someone who, unfortunately, is a graduate of a medical school with which I am associated. If he came back, he wouldn't graduate if I had him, I guarantee that. Some other questionable books, PMS, Program to Control, Coming to Terms with PMS, PMS, a Self-Help Guide, and Premenstrual Syndrome. All of these are books that I think have some things in them that are a little bit undesirable from the nutritional standpoint, and if you'd like the details on it, Nutrition Today, November, December 1987, has a good summary of our views about it. Now, there are a whole bunch of other inefficacious products that go along with a lot of these diets. In other words, it's not just diet alone. There are usually some other things as well. And some of these Mrs. Stevenson mentioned already, but let me just emphasize again. These are just some of the names of products we found that we don't think are efficacious. Efamol, PMS, Country Life Biochem formula. We don't see the evidence for any of these things really working. KAL, mineral PMS formula, positive menstrual support, evening primrose oil again, and PMS 43. So the evidence there for these things is not there. Well, it's not that people don't sometimes feel better after they use these things, because placebos are very powerful therapeutic tools. It's just that probably the dietary changes are not what's causing the positive effect. It's the fact of change itself. And my argument is to try to get more effective ways to change. And a couple of other observations, and then let's go on to a couple of other diseases and conditions. One is that many people experience premenstrual syndrome-related symptoms. Many, many women do so. The old notion that PMS was a mental illness, as Lizzie Borden successfully argued in Massachusetts back around the turn of the century, is not so. The American Psychiatric Societies or Association's DSM-3, the Diagnostic Manual for Mental Health Disorders, does not list this as a mental illness. Years ago it did, but now there's a different term used, and it's recognized that this isn't females just being sort of crazy. And I think anyone who's suffered from symptomatology like this knows that it's not all in your head. There certainly is an organic basis for it. It's just that we probably haven't yet become sophisticated enough to really understand the endocrinology that's going on here. But as of today, with what we know, at least from our best review of the evidence, diet is unlikely to cause it, to the best of our knowledge, and it's unlikely to cure it. Let me just mention one other piece that I think is a very good source. If you didn't get to see this Hippocrates magazine, it had a good series of articles on unproven remedies and also on quackery, which some of you may want to look at. It's really quite a good issue on that whole thing. Let me go on and talk a little bit about TMJ. My speech today seems to be made up of three letters, TMJ, PMS, and so forth. Well, TMJ is an interesting disease or condition. Lots of people suffer from this too. This is a problem of the jaw hinge bones. And some of you have probably experienced it yourself. You have aching or noise when you open your mouth very wide. You're supposed to be able to open your mouth wide enough for 3 fingers to go in. I don't think you should put the fingers in, but if you hear a click, it's possible you're suffering, but not necessarily. Some people click without having any problems. But basically, it's that little bone, it's the jaw hinge that we're talking about when we're talking about TMJ. And malfunction there causes pain in the temple, in the cheek, sometimes in the neck, and all down the jaw. So it's the temporomandibular joint is the joint that's right there in the jaw hinge that's the problem. And when we have limited or abnormal joint mobility, problems start, which include both joint pain and limited movement. Now, in a normal jaw, a disc separates the bones there, and in TMJ, sometimes this disc either pops loose or causes discomfort or pain or some other symptoms which are unpleasant. Now, these same sorts of symptoms may come from other things, such as grinding teeth, bruxism, and all of these other problems that those of you who are dentists know and love so well. The most common disorder, the most common sufferer of this disorder seems to be women. I guess I'm hitting women today, perhaps because I am one, in the age group about 15 to 44. Let me just show you some of the many reasons why this disorder can come up. And again, we see we're dealing with a syndrome. It's not a simple, straightforward sort of thing. It's like PMS. It's sort of vague, and there are lots of different things that can cause it. Chewing muscle problems, joint dysfunction of the joint, injury, degenerative joint disease. We see a lot of patients with very severe arthritis, and sometimes they have arthritis in their jaw, and this gives them pain and suffering of very much the same sort as people report in this disorder. Inflammatory joint disorders, chronic or restricted jaw movement, and sometimes just growth of the joint because of a tumor or something else that's pressing in. And also tooth clenching, always using the telephone on one side of the jaw. Some people, if they talk on the telephone, teenagers, for example, who talk for 6 and 8 hours at a time on the telephone, and other causes all come up. Well, why am I interested in it? Well, I'm interested in it because the treatments, there are a lot of different treatments, there are a lot of different causes to this disorder, and a lot of different treatments, but there's one treatment that's become rather popular in some circles in Boston, and which I'm very much opposed to, which I think is totally silly. We first became aware of this when one of our graduate students who suffered from this disorder and reported to a dentist who put her into treatment, did a very involved workup. This is a graduate student who's probably making $2,000 a year if she's making a penny, and proceeded to tell her that the bill would be about $500 and that there was more to come. And then told her that the way to cure this disease was for her to eliminate all sugar from her diet. That what was wrong with her was she was eating sugar in her diet, and it was causing contractions of the muscles of her jaw, and this was causing the pain that she was experiencing. It was quite evident that she was experiencing a great deal of pain. Luckily, she was a nutrition graduate student and immediately reported this whole nonsense to us, including diagrams that showed all of the various places you could suffer ill from if you ate sugar in your diet. And she proceeded to go to a different dentist who suggested that she stop chewing 3 packs of gum a day, and that perhaps trying that for a couple of weeks instead of giving up sugar would work. The gum she was chewing, I might add, was low or no sugar gum, so that wasn't the cause. The sugar was not the cause of her problem. It was the gum chewing, and it all went away. The problem is a lot of people aren't sophisticated enough to do that, and there are many patients in treatment for this disorder around the country who are buying into a lot of baloney. as well as not very much sugar, because they're being told to eliminate sugar from their diet. So this is another example of a disorder that really causes a lot of pain and suffering, and causes people to think they're crazy, even if they're not, when it turns out maybe some of the people who are advocating these things are the crazy ones. Let me just go on, and how am I doing time-wise? 5 minutes? Okay, 4 minutes. I'll do acne vulgaris in 5 minutes. That's easy. This is easy to do because one of the world experts on vitamin A is right here at Iowa State, and that's Jim Olson, who's done such fine work. Dr. Olson is a wonderful scientist, and I believe he's chairman of the Department of Biochemistry here at Iowa State. Well, why do I mention vitamin A when I talk about acne? Well, some of you probably know some of the exciting things that have been going on with respect to acne in the past 5 or 10 years. There are several notions. Well, what we think right now is one of the problems with acne are these plugs in the skin, and they're, the blackheads and whiteheads, and whether the plug is open or closed. I think the open ones are black and the closed ones are white. Basically, how can we deal with this disease, which often afflicts teenagers and makes them miserable? They just don't want to show their face at all. Well, there are many theories about this, and there are a lot of theories that you can understand might come, or we might think were due to diet. There are a lot of other diseases, or skin diseases, that seem to arise because of diet. For instance, people get hives from eating certain foods and so forth. So it's not entirely unreasonable to think that maybe diet has something to do with acne. And two great philosophies have emerged. One is the philosophy of the elimination diet, whether it be chocolate or a whole bunch of other substances. And a second philosophy is taking massive doses of vitamin A. There's no evidence either of these treatments work. But drugs do, and that's where I got to thinking about our colleague, Dr. Olson, who's done so much with vitamin A. Some of the cogeners of vitamin A, that is, substances that are close in their chemical structure to vitamin A, let me just turn back to that, do seem to help a little bit with cystic acne. They seem to have some of the characteristics of the vitamin. They're only sold by prescription, and I'll tell you enough about them to know that so that you'll know that they're very dangerous. I think I have an illustration of one of them right here. Yeah. One is tretinoin, or Retin A. This was on the cover of the Washington Post a little while ago. It's very popular because it's also being suggested as something that can help in terms of decreasing sun-related aging of the skin or wrinkles. And this was the first topical treatment that was used for acne. I guess it was about 15 years ago now at first. And it seems to alter the formation of keratin plugs, which are one of the problems with acne. One of the problems with this drug, though, is it is a drug, and it causes photosensitivity. And so you have to wear a sunblock if you're being treated by this, or otherwise you'll get a terrible burn. A second-generation drug that also seems to have some utility and is used more frequently now is something called isotretinoin, or Accutane, which is actually 13-cis-retinoic acid. And the problems with this particular drug, it does have good effects, and it does seem to work at least a little bit on the acne, but it also causes increased serum triglycerides, a dry and scaly skin, some other toxic symptoms, and most disturbing, it's teratogenic. So if somebody's pregnant or about to get pregnant, it can be real trouble. The third generation is Tigrin and some others, which are even, which I think it's retinate, I can never say it quite right, but that's even more teratogenic. So there's some problems with these drugs, and they certainly shouldn't be taken lightly. Now, so the notion that you can do the same thing with a vitamin A over the counter is wrong. It's a particularly dangerous thing for little children because toxicity levels in children are rather low. And self-treatment with acne with over-the-counter vitamin A can run into problems of megadosing with vitamin A. Toxicity in doses of 100,000 international units for several weeks or months, the RDA is what, about 5,000, can cause signs and symptoms such as fatigue, hair loss, vomiting, bone pain, itching, abdominal pain, scaly skin, and something very dramatic that I saw a couple of years ago, a woman who presented in our hospital with a brain, what she thought was a brain tumor, and which turned out to be due to about 5 years of huge doses taken every day. So not too much there in terms of the dietary sorts of remedies for this condition, but clearly evidence that perhaps there are some pharmaceutical treatments now that are effective. Let me just finish up with a couple of very brief remarks. The whole business of delinquency and overemphasis on the possibility that sugar causes crime was around a few years ago. This is something where the studies have been reviewed very nicely by Dr. Alf Harper and others. Harper's review appeared in 1986, showing that sugar and crime didn't seem to be very well connected. This first came about, at least as I see it, with a study up in one of the Scandinavian countries where aggressive antisocial men and non-aggressive antisocial men in prison were given tests of glucose tolerance in a jail. And it was discovered there were some differences between them. And from this, the gentleman who did the study made all sorts of claims suggesting that this was due to sugar in the diet and hypoglycemia and so forth. But as it's come out, doesn't look like that's the truth. Granted, there's every reason to think that we put an awful lot of emphasis on sweets, and this says the beautiful princess had honey hair and almond eyes and cherry lips, and the little boy wants to know if she was a woman or a cookie. This one talks about another theory that came out of about 10 years ago on this, the whole notion of natural diets for prisoners being the right way to go because of some studies done out, or not studies, but observations where a lady put a whole bunch of prisoners on an all-natural diet, and she found, or she thought she found, that they did better that way than they would do the other way. And these cavemen sit around and they think the natural diet's the answer too, but they all die at 31 years of age. Everything we eat is 100% natural, yet our life expectancy is only 31 years of age. Well, the basic point on all of this is that inadequate information exists to suggest that prisoners should have their diets altered, or that teenagers are delinquent because of this, and it just doesn't make much sense. With mental retardation, the use of very large doses of vitamins for mental retardation, again, the clinical trials that have been done suggest that for Down syndrome, for many other conditions, this just isn't effective. So there are a lot of unproven diets that we've talked about. There are a couple of others I just want to mention, and I'm sorry I'm running over. There's a lot of interest in foods and drugs. There's a lot more research we need to do. But here we have two people who have capitalized on this stuff and really, I think, are doing some things that are a little poorly supported by the scientific evidence. This is Stuart Berger, who's a diet doctor in New York. He's written this book that suggests that diet influences mood in various ways. Again, there's no support for any of these claims in any studies that he's done. A more difficult area is the whole issue of AIDS. And time precludes us talking about this. We know that the people who actually have AIDS are just a little bit of people up here, and there are a whole bunch of people who are HIV positive down below. And these people are being preyed upon with a whole bunch of dietary remedies, which we've described, and others too, Dr. Renner. But our work appeared in the Nutrition Today about a year ago. You don't get AIDS in restaurants, but a lot of people are using a whole bunch of dietary remedies for this disorder that simply don't work. There are a few standard therapies that are helpful. AZT is one investigational drug that's being used now, but the unproven therapies over here for this disorder are just enormous, and many include diet. There's some other therapies like these, some of these imaging things that also probably are not the right way to go. Let me just finish up here. Okay, let me just spend 2 more minutes. One is a couple of myths that we need to dispute. One is that scientists have closed minds about these new and unorthodox treatments, whether they're for diet or for some other reason. I would suggest that scientists are constantly testing new treatments and that there may be some interesting connections here that we need to do more work on, and I urge that we continue to do the studies, but that we must continue to prove and disprove these various claims. The second thing is that trying unproven remedies is a great idea. You can't lose. The answer is the gambling instinct is wrong. People lose a lot. They lose time. They lose money. They lose hope. And I think that's very important. What we do know in terms of positive counseling is that people who seek emotional support from their physicians or other healthcare providers are less likely to seek these unproven remedies than are people who feel that their providers don't have sensitivity to their problems. So what I urge is that we concentrate on developing better education methods for the general public and also for people who are sick, on discussing things, learn better ways to discuss them, how to discuss them, where. We need to overcome some of these patient, physician, healthcare provider, disease, and other communication barriers. And we need to be sure to support the people we're dealing with. There's always something that can be done that's useful and helpful. It may not be diet. We need to offer some relief. If we can't cure the disease, at least we can help people to feel better. We need to understand needs and to explore all remedies, to understand that people do that automatically. We need to help people identify the outright quackery that Mrs. Stevenson did such a good job this morning on, and to inform them about clinical trials if there's a disorder where there is one, and never, never to abandon the patient. Well, thank you very much. Let me mention one other book that you need to have on your shelf. I think a new edition's coming out in a year or two. This is the only one that exists right now, but it's still got a lot of data in it. It's by Ted Berland. He has all sorts of diets in it, including some of the ones I've talked about. And I saw him a couple weeks ago, and I think he's getting ready to write another one. So that's a good source of good things. For those of you who are dietitians, there's a lot you can do in terms of assessing the nutritional status of your patients, designing and managing good nutrition care plans for people that don't include these unproven things, but that do make sure they get the right nutrients and the right amounts, counseling, educating, and advocating for more tests. So I'm all for more of this, more study, and thank you.
Thank you. Before we start the question and answers, would you like to try a little unproven remedy for a numb rear end? Stand up and stretch. Thank you.
They did want you to announce where they were from, too.
Okay. step to one of the microphones. We have some questions from the audience at various sites. Peggy from Woodbury City or Woodburg City, Sioux City, would like to know, are there any foods known to cause problems in children who have a seizure disorder? And she brings up the possibility of NutraSweet being involved in seizure disorders.
I have to put on my glasses before I can think. Now I can think. To the best of my knowledge, there have been some people who have reported that they feel after they've had these, after they've had NutraSweet, they've had or whatever these artificial sweeteners are that were, whichever brand it was, they have problems. But to the best of my knowledge, as of today, I have not read conclusive evidence that that's the case. I know there are several people who are working on it, but as of the best of my reading, I have not read a story or a set of observations that suggests that this is a problem. Mrs. Stevenson or Dr. Runyon may have additional comments, but to the best of my knowledge, no.
Jennifer Anderson, calling from Arizona, would like to know if there is any information on special diets or dietary treatments for hyperactive children.
Well, the whole issue of hyperactivity is one which continues to bother the parents and others in the families and people who teach children with hyperactive disorders or attention deficit disorders. There's been a good deal of research on many different kinds of treatment for this. In terms of the dietary remedies, it's my understanding, and there are good reviews of this in the nutrition literature now, that only in a very small proportion of the total number of children who suffer from attention deficit disorder do any of the various dietary treatments, most of which are elimination diets, seem to have any utility, a very, very small percent. My own view and the view of the colleagues I work with who are psychologists and psychiatrists is that the most helpful combinations of therapies for these disorders seem to include educational treatment and tutoring and so forth, some psychological treatment, and in some cases pharmacologic treatment is helpful. So there are a combination of treatments. In terms of new dietary treatments, there are none that I know of that are efficacious.
We have several questions on attention deficit disorder or hyperactivity. You care to take those?
I'll try.
Okay. Have pharmaceutical products been scientifically proven to be effective for treatment of ADD? And is there a connection between ADD and sugar or caffeine?
The pharmaceutical thing, let me just get my own views out on this, and then, others can ask questions later. But one of the problems we had with this was back 20 years ago or so, some of these drugs were used perhaps more than they should have been. And some of you remember that some of the drugs that are used for attention deficit disorders include some of the amphetamines. And they have a paradoxical effect in this particular disorder. It's only one of the drugs that are used, but it turned out that people were not using them where children were given times off the drug. And growth disorders sometimes appeared, as you might expect. These are amphetamines, they're appetite depressants. Since that time, just as is the case with birth control pills, for example, people have gotten wiser in the way they've used them. The drugs have changed a little bit, and people have realized that sometimes even though one drug doesn't work, if you give a trial with another drug, it does work. It's like treating hypertension. If any of the people in the audience have hypertension, we have step care. We use a lot of different things. We start with the least difficult drug with the least side effects, and then we step up if that one doesn't work. So the drug therapy for these disorders is much more sophisticated and subtle and individualized than it was 20 years ago. I think 20 years ago, a lot of people used too much of these drugs, and they used them too indiscriminately. Now people are beginning to be much more cautious and careful. So that's the answer to the first one. The second was the issue of sugar and caffeine and attention deficit disorders, whether sugar in the diet would cause it or taking sugar out would cure it. And to the best of my knowledge, the trials of that are not positive. In other words, it doesn't show that there's very much effect on that. With the caffeine, that's an interesting question. Let me just give me a minute on caffeine, Jackie, and then I'll go back to your next question. Caffeineism is something that does exist. It is a syndrome. You can drink too much coffee. I guess if I were in Minnesota, I couldn't say that, but I'm in Iowa. When I was working in Wisconsin, I had a professor who drank 35 cups of coffee a day, and I think he had caffeineism. But basically, when you drink huge amounts of coffee, particularly when little kids do, they drink sometimes coffee, but they drink Coke, and they drink a whole bunch of other things that are high in caffeine. If they get up to huge amounts, they can suffer from nervousness and all of these other things. Whether it's quite the same as attention deficit disorder, which usually requires it requires several different independent judgments that the person is really having trouble in this way before you really diagnose that as a disorder or not is a question. So the caffeine, some children are probably using more caffeine than they should, but this is not the cause of attention deficit disorder. This is a separate syndrome that's called caffeineism.
I might add those questions on attention deficit disorder or hyperactivity came from Storm Lake, Iowa, Jackson, Ohio, and Spokane, Washington. So people all over the country seem to have similar problems. The next question, and we will have to cut this off, I believe, because more questions are coming in, but we have another speaker, and we don't want to run behind on the schedule. Shall we make this the last question then for this session? Kathy, Bell Valley, Ohio, would like to know, she has heard of a water-soluble vitamin A that is available over the counter and really wants to know if there is such a thing and what exactly is it referring to.
I think I'll have to defer to the Food and Drug Administration. I know there are water-soluble forms of vitamin D. At least I'm getting to the fat-soluble ones. And for children, for little babies, that's the preferable form to use because you can get a lipoid pneumonia if you use the other forms. In terms of water-soluble vitamin A, I think there is such a form, but I'd have to defer to somebody who's more knowledgeable in pharmacology than I am. It's a good question. All of these questions are terrific, and I hope we have time during the discussion to answer some more of them, or to not answer them, whichever you think we're doing.
Thanks very much, Johanna.
Our final speaker today comes to us from Pima College in Tucson, Arizona, where he is Professor of Health and Life Sciences. Jim Lowell has dedicated much of his professional career and his personal life to combating this pervasive and insidious problem we've been talking about today, health fraud. He's provided expert consultation to the Food and Drug Administration and various state attorney general's offices, including, I'm happy to say, the Iowa Attorney General's office. Jim serves on the advisory board of the American Council on Science and Health and the editorial board of a publication I'm sure many of you are familiar with, the Nutrition Forum. Currently, Jim serves as vice president of an organization you've heard referred to today, the National Council Against Health Fraud, and I'll be speaking about that organization a little more later. I'm pleased to present my friend and fellow quackbuster, Dr. James Lowell.
Well, let me get things adjusted here. This seems there. How's that? Now can I be heard? Very good. My role in this is a little bit different from some of the other people you've heard. I think I'd be called a hands-on person. Not that I practice quackery too much, though. We do a lot of the odd nutritional tests in our labs, and if any of you need a little checkup after my speech and you have a check for $100, I take checks. And some of the devices I'll show you we do have for sale, and they'll help some of your problems. I've been asked today to talk primarily about cancer treatments, and primarily in the Tijuana clinics. And what I've really done for you is tried to put together a presentation that combines that which is currently called alternative medicine. Now, we've heard that there's some problems with the definition alternative. I think it's no alternative at all if it doesn't help you. Nevertheless, the people who do it call themselves that. The OTC is testing it. Or OTA rather, is testing it, and there are a large number of practitioners licensed by various states who claim that they are alternative practitioners. Examples are chiropractors who are licensed in every state in the country. And they share in common some specific techniques, and those techniques then are also used in Mexico, in the Tijuana clinics, and in Europe and worldwide. So I'd like to not only show you what the clinics are and what goes on inside of them, but try to give you a feeling for that kind of thing you might experience if you went to any kind of alternative healer, be it in Mexico or a local chiropractor who may practice some of these things. Some do just manipulative therapy, others do other things. So you can go anywhere in the country, anywhere in the world, and you'll see parts of the thing I'm trying to put together for you. And if you become a faddist or a cultist, and these people are cultists, then you might do all of these things. But we'll have some pictures for you then a little later of the inside of a Tijuana clinic with some of the patients and a little experiment we tried with the practitioner. So let's go on to the first slide. Do I have to turn the lights off here? Projector on, off. Oh, no, look at that. There it is. I want to point out that's me. I went and had that picture taken, and nobody ever recognizes me, so I guess maybe it was a waste of money. Was that it? I think the black ran off that felt hat. They had that in one of those same places where they have the nice velvet paintings, you know, with the crying crucifix people and stuff. In any case, I'll try to keep this primarily to cancer, though. What I'm telling you will cure any disease, and I'll explain to you why that's true later. And actually, if you listen well when I'm done, you will be able to cure any disease. You may want to quit the current job you have and go into one of these lucrative fields because you'll probably make a lot more than you are. Cancer, well, let's see, forward, back. It hasn't cured my eyes, though. Cancer is one of the most dreaded diseases, and there are various reasons that people fear it. The kinds of practitioners I'm talking about are very happy about that because it helps them get customers. The American Cancer Society, or this was a quote I thought was very nice just to get started by Catherine Simmons that appeared in JAMA a while back. For every physician unable to cure the incurable, there are countless charlatans who claim they can, and these are the people I'm going to introduce you to. The American Cancer Society Unproven Methods of Cancer Management booklet in 1982 did a survey. For this booklet, they did a survey to see what people felt about cancer and cancer remedies. And these are the points of agreement among patients, that they feared that cancer is incurable, and as you may know, some kinds of cancer are totally incurable, other types are totally curable. So it depends on what it is. Fear the treatment is expensive, that varies too with the types of cancer. Fear of surgery, radiation, or chemotherapy. Fear that doctors have given up hope. Fear of mental or physical disability as a result of the cancer or the treatment, and fear for their families. What will happen to my family if I die? These are the very fears played upon by the charlatans who treat cancer patients. And in surveying the types of claims these people make, we've found that these are the most common. First of all, they would like you to believe that cancer is a single disease and can be treated by a single modality. For example, Laetrile is still widely promoted. It will cure all kinds of cancer, period. That was the original claim and still is sometimes. Cancer, in fact, is several hundred different diseases and cannot be treated by the same modality. Cancer is spreading like wildfire. There is an epidemic. In fact, when you age adjust the data, most cancers are not spreading. They are staying about the same. Some are going down and some are going up, noticeably lung cancer, and especially in women. That is really becoming epidemic. Ladies, stop smoking. Cancer is rarely curable by standard modalities. That depends on the type of cancer. There are cancer-free societies living in the world, and this one's of some interest. They talk about the Abkhazians in Russia, various groups, the Hunzakots, and claim that these people live to be 120 years old and that those societies are cancer-free. And of course, they then claim that they have discovered the secret which allows the long life and cancer freedom of these societies. Well, there are three primary societies that have been looked at, and cancer is common in all of them, and the people are not especially long-lived in any of them. That there's a conspiracy against curing cancer by people like the Dietetic Association, American Medical Association, the National Cancer Institute, the pharmaceutical countries. They say that cancer is a multi-billion-dollar a year business, and that these people don't want it cured. And of course, these people themselves die from cancer, and their families die of cancer. You'd think that they would at least save themselves. That quacks offer a last chance for the terminally ill. Well, in fact, they offer no chance at all, and I'll talk about that in a few minutes. And when you look at some of the things they do, I think you'll see why. And finally, science is closed-minded toward newer, unorthodox cancer treatments. They would have us be so open-minded that our brains fell out. Okay. In fact, it is not the real research being done. The real experimentation being done is being done by the so-called orthodox community. Most of the practices of the cancer quacks date back centuries. They'll use herbs that were used before we knew any pharmacology. They'll use enemas, things that were used thousands of years ago, before we knew what we do about current medicine, and I'd like to show you a little bit about those things. Here are some examples of the kinds of literature or products they put out that support the list of items I just gave you. This is called The Great Medical Monopoly Wars. It purports to show how various medical people are hiding the truth about cancer. And as a matter of fact, because of this book, the head of it, Lisa, the writer of the book, has been sued along with 27 major quack organizations and quacks by Dr. Victor Herbert, with whom you may be familiar, and a few others. This is the kind of thing they'll do to scare people. If a patient you have is diagnosed with cancer of any sort, within a few days he may receive literature like this in the mail, how surgery will just cut people and mutilate them, how radiation will burn and destroy them, and then the chemotherapeutics will do nothing but poison them, but nevertheless something like Laetrile, which they have dubbed vitamin B17, although no such a vitamin exists, will cure you. This is an example of how they'd say the AMA is just the puppet of the drug industry who controls everything that's done and is withholding the cure so they can continue to get rich with all the medical procedures. How successful are they at convincing people? Barry Casleth from University of Pennsylvania did a study in which she examined 660 cancer patients, and she found that 8% of them never received orthodox treatment, only unorthodox treatment. That is, these so-called alternatives. 54% also, who were getting orthodox treatment, received unconventional therapy at the same time. 40% after trying unorthodox treatment abandoned their conventional care. Now, this is pretty serious. That means people who might be saved can die as a result. I'll give you an example of that later. 60% of unorthodox practitioners were MDs. And I think that's very significant. In our state, Arizona, for example, we have a homeopathic licensing board. It has 30 people licensed from around the country, and they all practice, or essentially all of them practice, some pretty strange medicine. A lot of MDs are telling patients, go ahead down to the Tijuana clinics. I can't do anything more for you. Or maybe saying, well, I'll try this vitamin regimen or something just to try to make the patient feel a little better, and we feel that's a terrible mistake. I want to concentrate on the idea of food faddism, and I can't completely do that because there are other aspects of unconventional treatment that relate to the food fatism part. You can't separate one from the other. So I have to tell you about some things like healing energy bodies and adjusting auras and some of the kinds of things beside just the food fatism part. But may I tell you that a major part of essentially every unorthodox cancer therapy, the major part in most, is related to food fatism and food cultism. And the basic premise is that diet is the major factor in health, disease, intellect, behavior, essentially everything, and that you are what you eat, and furthermore than that, because diet causes these problems, that a change in diet can cure them. And of course, we know that smoking can be a major and is the major cause of lung cancer. However, cessation of smoking does not cure it. And so the problem here is mixing cause and effect often. And of course, the other problem is that diet, in fact, does not cause all these things, even though it may be a cause of cancer in some cases. Here are some of the kinds of books put out by major promoters of questionable products. Maureen Salomon is head of the National Health Federation, an organization which holds conventions around the country, works with the health foods industry, and promotes all kinds of questionable treatments. She and her husband, former husband, they just got divorced, run a clinic in Tijuana where they inject people with fetal animal cells with the claim it'll reverse their aging. Virginia Livingston Wheeler is an MD who practices in San Diego, who says that a bacterium causes cancer and that with her vaccine she's developed in diet she can cure it. She cannot. It's just recently had a test. The kinds of comments made about the food supply are ones you've generally heard, and I just sort of want to run them by you because these are the kinds of claims that help convince people that their diet is the cause of disease and that if they change their diet it will cure you. Very quickly, soil is depleted, so vitamin and mineral makeup of food is inadequate. That's nonsense. The mineral makeup can vary a little depending. There are about 4 minerals that people need that plants don't, like fluorine, that can be deficient in plants, zinc sometimes. Very few of these, though, the plants don't need, and if they don't have them, they die. So generally, minerals aren't a problem. The vitamin makeup is genetic. They say people are being poisoned or harmed by additives, and generally that's also not the case. And we run into problems like the ALAR problem. ALAR's never been shown to cause cancer in anyone. Not in one case has it even ever been shown to be carcinogenic. Yet look at the problems we're currently having with it. And we put our emphasis often in the wrong place. We're killing 500,000 people a year with cigarettes while we're worrying about ALAR. Now, I'm not saying we should load food with a bunch of additives that could be dangerous. I'm saying we're not always putting our emphasis in the right place. Processing destroys nutritive value, and processing, of course, does destroy some nutritive value and preserves the rest of it, which is the point of a large part of processing. So as a result, we probably have the best diets people have ever had. We can go to the store and buy things we never heard of even 15 years ago. Fresh fruits and vegetables all year. We market it better, we preserve it better. And natural and organic foods are good, while others lack nutritive value. And in essentially every test ever done of both organic and non-organic, so-called non-organically grown foods, their nutritional value is equivalent. But the words have been robbed of their dictionary meaning. What does natural mean? It means as found in nature. You go to the store and practically every brand of potato chips you buy will say natural potato chips. You will not find them in nature. They don't exist. They're not natural. They're processed. Here's natural imitation ketchup. Okay. The words have been robbed of their dictionary meaning by the food faddists, who then convince you that their product, that what they do is non-toxic, harmless, non-drug related therapy, where in fact it's toxic, it is drug related, and they can kill you with their products and regimens. Laetrile, 6% cyanide by weight. It's sugar with benzaldehyde and 6% cyanide. We stopped grapes from coming in because a couple had minute levels of cyanide. 27 states sell this stuff, which is 6% by weight, and if you take the recommended dose, you will show symptoms of cyanide poisoning. Yet 27 states allow the sale of it. Books abound in the bookstores telling you how it's going to cure your cancer. And of course, people can print this, but states don't have to legalize the sale of it. Nevertheless, they have. And it shows you something about the strength of the lobbies of the industry of health foods. Well, let's move on to a little bit about what the clinics are like and the cancers are like. In the United States, it turns out cancer is a little bit different from the way it is in Tijuana. You may not have realized that, not having been to Mexico lately. But here, the symptoms are those which you first recognize often are those from the American Cancer Society: changes in bowel or bladder habits, non-healing sores, unusual bleeding, discharge, lumps, indigestion, difficulty swallowing, and generally these things are over the long term or fairly long term. Change in a mole or wart, nagging cough, hoarseness, or detection by a physician by palpation or because for some reason he expects you might have a problem. The general diagnostic tests here, for the most part, consist of palpation, feeling it, x-ray, and biopsy and specific blood work. And I want to emphasize that aspect because there are various nutritional tests given not only in this country but in Tijuana, which are somewhat different from the normal way cancer is diagnosed. And finally, our primary treatments are surgery, radiation, chemotherapy, and hormones. And then along with that, there are some other experimental therapies such as hypothermia, etc. But these are the major ones that most people would come across. Tijuana, one of the major diseases you get is precancer. And precancer occurs when they give you a test that detects cancer in you that no legitimate test can detect. So they'll say, I've given you this test, you don't have cancer yet, but you have a precancerous condition. And therefore, if you don't take my treatment, you will get cancer. Then they give you the treatment. A year later, you haven't gotten the cancer, and they say, see, it worked. Okay? Very powerful, and then they get testimonials that you've cured them. Some of the things they say you can do is look at the iris and see it. I'll explain that to you in a minute. They say that cancer is just tumors. And of course, many kinds of cancers don't have any visible tumors at all. They have diagnostic tests, which are various blood tests, some of which are real and some of which are not real. I'll show you a few of those. They use applied kinesiology, which I'll describe under the tests, and even radionics, where they wave a pendulum over your blood sample, and depending on which way it swings, they determine whether or not you have cancer. They'll do accompanying tests, which are often to help determine your nutritional status, according to them, like hair analysis and the metabolic intolerance test, which is just another name for cytotoxic testing. You put blood on a slide, and if after a while the white cells break, then you're supposedly allergic. Oh, well, you put it on, and then you put a drop of a food on it. If they break after a while, that's supposed to mean you're allergic to the food. And if you run it well, you can be allergic to every food by the time you're done. Then some of the treatments include things like vitamins, minerals, glandulars, enzymes, detoxification, special healing diets, and other special medications, and I'd like to show you samples of each of these. So actually, you may be able to go to your chiropractor and have them run these tests on you, because a large number of chiropractors here who supposedly don't treat cancer really do, and they'll run all these tests. Or you may even be able to go in the back of your health food store and get some of these tests run. Or you may be able to send away in the back of a magazine for some of them, and you can pee in a bottle and send it back to the lab, and they'll tell you if you have cancer from your urine. Let me give you an example to start out with of what I consider the worst Tijuana clinic. It's run by a man by the name of Jimmy Keller. He's a former water softener salesman. He opened a clinic in Matamoros, Mexico, south of Brownsville, till finally he basically got run out. Is wanted on an FBI warrant in this country and cannot come back. He has no medical training whatsoever. After leaving Matamoros, he went to Tijuana, where he now has his clinic. This is the front of the clinic, and this place probably would be like your worst vision of a back alley abortion mill. You walk down a long hallway to the back where there's a small room with sort of old beat-up, torn-up couches with the spring sticking out. The windows are open and the chickens are running around the backyard. Out into the street and on the floor are used syringes, bloody cotton balls, that kind of thing. On the right, as you look at that room, is a room where he gives people IVs, which he makes up himself. The bathroom, there are like 4 beds just sort of pushed together with people crowded into them. On the right-hand side is the bathroom. When you use the John, you have to go into the bathtub and take bottles of water, which you pour in the back of the toilet so you can flush it because there's no running water. Then on the other side is the room where he looks at the patients and makes up his concoctions, which vary from week to week. This is Jimmy Keller. He himself had to have an ear and part of his lymphatic system removed because of a cancer he had. It saved him, but he says it was Laetrile and alternative therapies that did it. Now, let me show you what his treatment is and what he makes. He calls it Keller Metabolic Therapy. You stay 21 days, but it's outpatient. The basic cost, as of last July, we update these once a year, was $3,600. $1,500 the first week, cash up front, and the balance each week of the $3,600. He says he can cure all types of cancer. He gives you vitamins, amino acids. He gives you what he calls oral oxymedicine, which is supposed to be oral O7, which doesn't exist, so who knows what that is. He uses Socanar, which is he calls an Argentine formula. It's an herb that is brought up from South America. Cobra venom he says he uses. That'd be interesting to know where he gets it, because that's not easy to come by. And what he gives you varies. He says he can help at least 80% of the patients. He hugs them a lot. He tests them with applied kinesiology, which I'll show you in a second. And the data is not available to the public. Right now, figure this out quickly on your little calculators. The last time we were there, at the $1,500 a week, he had 35 new patients starting. So you take 1,500 times 35 times 3, which will tell you how many are there at once. Approximately 100 patients at an average of $1,300 a week. That's about $130,000 a week, somewhere in there, that he pulls out of this backroom clinic. And then he sends them home to die. Probably the biggest catch-all term is metabolic therapy. You saw some of the other ones, alternative therapies, holistic therapies, but metabolic therapy is the term currently used by most of the practitioners nationwide, worldwide, and in Tijuana. And let me tell you what that is briefly. First, you diagnose the person, but it doesn't make any difference what their disease is, which is sort of interesting, because all diseases are caused by the same thing. So the diagnosis is really technically useless, according to what they say. Nevertheless, they have a bunch of diagnostic tests. What causes all disease is a buildup of toxins in your system, and these toxins are unnamed. But after all, it might be a preservative on food, it might be pollution you got, but it's never named. They never really look at you to see if you have lead poisoning or something like that. A buildup of toxins from your diet is what's supposed to cause all disease, and this plugs up your cells. So what you have to do is be detoxified. We must first get the toxins out, and then the body can heal itself. That's the pitch. They say doctors, regular doctors, just treat the symptoms. They claim to treat the cause of the disease. And that's